A very good evening to you and welcome to our TV News with me, Fiona Mbabazi. Now, officials in Rwanda's Ministry of Health have given assurances that preparations for CHOGM 2021, slated for June here in Kigali, have continued unhindered, with measures being taken to ensure that the health sector is able to handle tasks from the medical services they may need. We do have the story with Serge Nori.
This is the VIP emergency ward that has been set up at King Faisal Hospital here in Kigali. It was decided that the emergency ward should be renovated to include a VIP wing, especially with the way our country hosts different major events, so that it can cater to people at that level, giving them services similar to what they may find back home in developed countries. Private clinics and hospitals like Legacy have also been gearing up for the task at hand. We in the health sector have been preparing for a while now so that we are able to provide the sort of services those who will be coming may need. I say this on behalf of the Legacy Clinic, of course. We have specialists here and nurses too who are all ready. When it comes to logistics, we have ambulances, and I've also set up a state-of-the-art diagnostics center with all the necessary equipment, including an MRI machine, which we ordered and are preparing to receive, as well as a CT scan machine and lab to be able to identify illnesses quickly. At the University Teaching Hospital of Kigali, ambulance teams have continued with their preparations, and officials in the Ministry of Health say nothing is being left to chance, especially with the global pandemic still a threat. We will have teams of doctors right from the airport all the way to the meeting venues and hotels where delegates will be staying. The teams will include specialists, just in case of emergencies. We have ambulances ready and are coordinating with the country's major hospitals, starting with King Faisal Hospital, the Rwanda Military Hospital and Sehashika, where we will have doctors on standby. We also have rooms set aside for anyone that may need to go to hospital for tests or treatment. The preparations are also taking into account all sectors that will be involved in such a major event. All delegates will be tested, and there will be a team in charge of that, just like even now we have teams doing that. There is a lab that has been set up to provide results in the fastest way possible. Like the delegates, anyone involved in the preparations and during the conference itself will also be tested. In a broader sense, sectors involved in such important events are also being vaccinated, and by June all people involved in those sectors will have been vaccinated. Also, in cases when a delegate is found to have contracted COVID, they will be isolated in a different apartment or hotel away from the other delegates who don't have COVID. During her recent visit in the country, the Secretary General of the Commonwealth commended Rwanda for the way preparations have been going, noting that such preparedness is what has allowed the conference to be organized in the first place after being postponed last year because of the COVID-19 pandemic.
Now, a team of historian experts on France's role in the genocide against the Tutsis in Rwanda has concluded that France played a key and alarming role. Now, this is according to a report by a commission of about 15 researchers and historians commissioned by French President Emmanuel Macron to investigate the country's role in the genocide against the Tutsis here in Rwanda. Now, the report covers nearly 1,000 papers and was presented to President Macron this Friday evening. Now, the commission, led by historian Vincent Declercq, noted that France had played a key role in the genocide against the Tutsis in Rwanda, but that there was no legal complicity in the genocide. Now, the report accuses former French President François Mitterrand and his entourage of backing the government that organized and carried out the genocide against the Tutsis, especially in the provision of arms. In May 2018, when President Paul Kagame paid a working visit to France at the invitation of President Emmanuel Macron, it was President Macron who decided to set up the commission to review France's archives on its relations with Rwanda from 1990 to 1994. And the commission was set up in October 2019.
French officials gave priority to policies that ignored the truth, policies that had elements of colonialism, seriously promoting ethnic divisionism. Those officials were blind to the fact that Rwanda would go beyond those very policies. French officials made the problem of ethnic division worse and backed Habyarimana's regime that was characterized by ethnic division and were unable to steer Habyarimana away from his extremist ways. That was the French policy President Mitterrand wanted in Rwanda. Most importantly, Mitterrand had a special friendship with Habyarimana, and the latter did everything in his power to receive everything from France, changing nothing. An example would be the ID cards that indicated a person's tribe that were used to kill Tutsis during the genocide. France should have pressured him and refused to provide him with military aid as long as Habyarimana did not have those ID cards changed, but nothing was done.
Now, in a statement that has been released by the government of Rwanda on the Duclair Commission report, the government of Rwanda welcomes the report of the Duclair Commission, which represents an important step towards a common understanding of France's role in the genocide against the Tutsi. An investigative report commissioned by the government of Rwanda in 2017 will be released in the coming weeks, the conclusions of which will be complement and enrich those of the Duclair Commission. Now, during a virtual consultative meeting consisting of representatives of the various organs and experts, the Rwanda Women Parliamentarian Forum, it was decided that various institutions should join forces in fighting against malnutrition and stunting among children. Jen Mutoni with the report.
The primary objective of the meeting was to discuss on the role to be played by each individual and institutional level towards implementing the national multi-sector strategies and plans put in place to strengthen the family's capacity with a focus on the promotion of good nutrition and fight against children stunting. However, there have been challenges in the way of achieving good nutrition for children. The Rwanda Women Parliamentary Forum focuses on issues affecting the laws of gender equality, which include inequality in the sharing of responsibilities among both parents in a household, mostly in the rural areas, whereby women are overwhelmed with a lot of domestic work, like taking care of the children, that they don't get time to do other activities which may generate income for the family. It has also been proven by the statistics as they show that families in rural areas and families with extreme poverty are the ones which have the highest rate of childhood stunting. Some of the members of the Women Parliamentary Forum say more effort is required in terms of implementing solutions to this issue. Vegetable gardens help a lot in attaining a balanced diet. However, in many homes, they no longer exist, yet we've invested a lot of effort in emphasizing it. My suggestion is that people should work together in their respective village groups in encouraging all residents to have vegetable gardens. A lot of people still don't know much about childhood stunting, which is an issue itself. We've learned that stunting begins as the child is still in the womb. Most of the people we've managed to speak to say it is caused by malnutrition. This is why I think more emphasis should be put in raising awareness and educating people. The Minister of Gender and Family Promotion, Professor Bayisenge Jeannette, points out that the programs put in place have been productive. We've started up a formula in Nyabihu district whereby each child has a medical file that is used to monitor all follow-ups on their health with the help of village heads and health consultants at the CNFA, of which has proven useful and expand to other districts as well, like Rutsiro, Nyaruguru, Gakenke and Kayonza, while using technology in sharing information or updates, along with all the problems a child is facing, and local community health workers can also access it. Currently, 33% of children in Rwanda suffer from childhood stunting, while the goal is to reduce it to 19% in the next 3 years and to completely eradicate this issue by 2035. Jane Mutoni reporting for RTV.
Financial Intelligence Center officials say that despite the transfer from the Rwanda Investigation Bureau, the two agencies will continue to work closely together to ensure the expected results. We have the story with Omali Jade.
A year ago, the Financial Intelligence Center was established. It is the body responsible for prosecuting crimes related to money laundering, financing terrorism, and crimes related to the proliferation of weapons of mass destruction. Prosecution of such offenses is a common responsibility of the Rwanda Investigation Bureau. It was established in 2018. Rwanda Investigation Bureau Secretary General Colonel Jeanette Ruhunga explains that although these responsibilities have been handed over to the Financial Intelligence Service, this does not mean that the interaction between the two institutions is stagnant.
Izo nshingano n'ubundi zikorana.
Those types of responsibilities complement regular investigative work, and any irregularities they may find in their intelligence gathering will be given to our investigators so that they may follow up on them. They may now be an independent agency separate from RIB, but nevertheless cooperation between the two will continue.
Prior to the establishment and reassignment of these cases to the Rwanda Investigation Bureau, they had been handled by the National Police since 2011. The Director General of the Financial Intelligence Center, Jean-Pauline Gashumba, emphasizes that this has helped build a foundation for the operations of the new agency. There will be cooperation when it comes to capacity building among employees to deal with things like money laundering and financing terrorism and the trafficking of weapons. Our cooperation is extensive, and I believe it will be tightened further so that we become more effective in fighting such crimes. In January 2020, the law establishing the Financial Intelligence Center was passed by the government. A similar level exists in countries that cooperate with the World Bank to monitor the transfer of funds for security purposes. Umngari Jade, RTV News.
A research conducted by the Transparency International Rwanda and made public on Friday highlights some of the key areas in health service delivery that are experiencing some challenges. We have the details with Gabi Muvunyi.
Those in need of various medical services in hospitals across the country say that there is a gap in health service delivery in some of the hospitals they visit.
When you come to the doctor despite your weak state, they give you an appointment as far off as 7 months away, yet you are in pain. This is one aspect they should fix in hospitals. I went to the doctor last September and I was treated this year in March. Imagine all that time I spent. The services are good. They teach us ways we should protect ourselves from COVID-19, to first wash our hands at all times. Things are going well. There isn't any problem.
Transparency International Rwanda, in a study highlighted on health service delivery during this COVID-19 pandemic, where some of the findings showed that there is corruption in clinics around the country. The chairperson of Transparency International Rwanda, Ingabire Marie Immaculée, says, according to research, it is evident that there is corruption taking place in the healthcare system.
That in some services, health services, it has been some cases of corruption, which is somehow understandable because it's due to lack of staff in that services. Then they were asking for some money, especially in maternity services, because you know, if you are to give birth, you can't wait. You know, it must be happening. So, and you know, there are a lot of transfers from health centers to hospitals, and to have those urgent service, they were obliged to pay something.
The Chief Technical Advisor at the Ministry of Health, Dr. Theophile Dushime, says that in the face of COVID-19, Rwanda is stepping up its efforts to improve health services, despite some of the obstacles, such as delaying of doctors getting to their workplace late. He adds that the Ministry of Health is unaware of any complaints about bribery or bribery in clinics, and is urging residents to report any of these incidents.
there is no case reported of corruption in our health facilities, and we discourage any similar behavior from healthcare workers, and we also request the general population not to allow this to happen. If there is any attempt to ask anything related to corruption, they should immediately report to the health facility manager and the other authorities, including local authorities and other institutions such as the National Police or RIP.
In Rwanda, a study was conducted in clinics around 5 districts in the country and found that during the current COVID-19 period, 3% of the patients received healthcare services through bribery. Transfer services topped the list at corruption rate of 27.8%, followed by immunization services. Gabi Muvunyi for RTV.
My name is Mike Kaihura, and I am here to brighten up your international news. With Kenya's COVID-19 cases and deaths surging, President Uhuru Kenyatta has announced tightened restrictions in 5 of the most affected counties. The new restrictions have been imposed in the country's capital, Nairobi, and the 3 urban counties surrounding it, plus Nakuru, a major transit city. A third wave of COVID-19 is at hand in Kenya, said Kenyatta in a nationally televised address. The death rate is devastating by all measures, and the stress the pandemic is placing on our health system is unparalleled.
You want to sing first for us, a freestyle before we start our interview?
A freestyle. So I think I'll sing the song that we just came from shooting that as well.
Oh, nice.
It's actually the song that ends this video. It's called Jaribu. It's for any time. So I'll do something small about it. So something like, I don't like another man on your timetable. I don't like it, even though homies you rolling with, you calling your friends. I don't like the way you getting high without me. I dislike it, you rolling with the wrong ones, you looking funny. Ooh, boo, 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 yeah. You're a blessing from the highest, I can guarantee. Keeping it private on the regular is what you need. Step out the hard box and dance for me. Shake off the groupies, it's an Nancy, yeah. No go susanganya kababaro loki. Anytime you show go hinduka. Anytime you touch me I lose control. No go susanganya kukagache baby. In any case tabizi kunyikundira. In any case tonight it is dangerous. We wild and yeah we wild and wild and with my baby. Wild and yeah, we wild and...
Amazing, amazing. Thank you very much, Mike, for that.
Thank you for having me.
As a start off, maybe, or anyway, how was the experience, first of all, reading the news? This is your first time, yeah?
First time.
How was it?
I was really nervous. It was really cool. I felt like it was fun.
Yeah, it was very...
definitely not an easy thing to do.
But once you get the drift of it, it's quite easy, yeah? So who is Mike Kaihura?
Mike Kaihura is a singer-songwriter, and songwriting is something I'm trying to branch into. I've been working on a project at the moment that I'm looking to release called Zuba, and Mike Kaihura is a singer-songwriter, passionate about music, and pushing on through it.
I know that you've written some songs for some of our famous artists. What songs did you write, and for who?
I've written a couple of songs. But the only one so far that's out, I'd say, is Katerina, Bruce Melody.
Bruce Melody, yeah.
That was my first experience writing for somebody else. It was a beautiful experience, especially based on the feedback it got around the continent and so on. It was a beautiful feeling. So there's a lot more coming based on that I can't wait to share.
How did you start off? How did you know that you're going to sing, that you can write? How did you start off this career?
Music started for me in church. I started singing in the choir at the age of 13, and ever since then, that's been something I've always wanted to do. Of course, like before getting into church, I always had other visions and different dreams that I wanted to get into, but music seemed to be that refuge for me, you know, amongst all things. It was more than just something I loved to do. It was more of a refuge because I felt alive with it, and I stuck to it. Yeah.
So who inspires you musically when you want to write, when you want to go deep into those thoughts, you know, and sing? Who inspires you?
My number one inspiration? Look, I'm inspired by so many sounds, so many genres, but there's always this one artist that obviously elevates you, and for me that's Stevie Wonder.
Wow.
I think for me he's the greatest of all time. People know the fact that he's blind and plays everything and every instrument. He's a great songwriter, and music for me, based on what I hear and what he's released, and I believe he has so much more to give. It feels like he's digging into somewhere that there's so much more, you know, like it's an endless, like unending bag of gems and so many. So I think Stevie Wonder for me would be the number one.
The number one musical inspiration
definitely.
for you.
Yeah.
You know, on Twitter or, you know, social media, everyone was telling us as Sabrina. Please ask him to sing Sabrina.
Cause Sabrina, love on that liquor. She got 44,000, oh, she's a deeper. Riding me deeper. She got no one to tell her. Tell her to fly to the moon.
I think that's one of my personal favorite songs, you know. Yeah. So how do you feel about the creative space in the country today, Mike?
I genuinely feel that 2020 was such a letdown, because I feel like that was a year that so many genres were evolving, so many artists had so much to give. It was devastating. I feel like that really slowed down so much. It was such a perfect time because I say that based on what I've been listening to. There's a lot of Kenya trap coming through. There's a lot of new R&B sounds and fusions with Afro fusions, and so the space right now is amazing because collaborations are happening, and that's something we never really had with the years that have passed, and so much more. I think the collaborative energy that's happening now, and the pandemic and everything happening, is an absolute letdown. But I believe it's going to grow regardless of what's happening. We're still linking up, we're still creating, and yeah, it's promising.
Absolutely. The major collabo that you do and say, damn, man, I've really done it.
Yeah.
You know, what's that dream collabo for you?
The dream collabo.
Yeah.
At the moment, based on the sounds I'm trying to create, I've said this before. I think Sauti Sol. Sauti Sol for me would be a dream collaboration.
Absolutely. Yeah. As we sum up, baby, make the director telling me we've run out of time. What are you currently working on right now?
We just finished a video at the moment, a video for an audio called Anytime. Anytime is the second release we're releasing for the EP Zuba, so it follows Jaribu. It's an exciting song. I'm really excited to share it, and it's obviously a new sound I'm getting into. And apart from Zuba, the EP I'm working on, I'm also working on an album called The Rhythm of the Rising Spear, and an album I'm really excited about. I'm really can't wait to share as well. Yeah.
I know, those are things we're looking forward to. Thank you very much, Mike, for making time to be with us. Well, as usual, my name is Finan Babazi. Thank you very much for joining us this evening. Have yourselves a blessed and fruitful weekend ahead. And do remember that COVID-19 is still here with us. So play your roles right, especially as we continue to flatten the curve in the country. Good night.